Traditionally, it may be thought that safeguarding in primary care is only the responsibility of GPs and nursing staff. In reality, patients can only be effectively safeguarded if all members of the primary care team work together. Every member plays a vital role through the job that they do. As a GP, I rely heavily on the whole practice team to work in partnership with our patients to safeguard them. No one can safeguard on their own.
Safeguarding children is often referred to as a jigsaw puzzle, whereby little bits of information have to be put together to try and create a picture of what life is like for a particular child, and then decisions can be made about what intervention is needed. So within any primary care practice, it may be any member of staff that has some really important bits of information, important pieces of the puzzle. So for example, it may be your receptionist that's observed a particular interaction between a child and a parent out in the waiting room. It might be your dispenser that's got some really important information about a parent who's not connected a prescription for their child. Or it may be one of the GP partners who holds some really important information about a parent's mental health condition, which means that it might be very difficult for them to safely parent their child. And each of those pieces of information has got to be put together within the practice to try and understand what's going on. Because we know that in safeguarding, we make decisions based on the information we have available. So if we have poor information, we make poor decisions, and ultimately that results in poor outcomes for children and families.
As the eyes and ears of the practice, we are well placed to identify the most vulnerable patients. For example, when an elderly patient who has dementia comes in and is quite confused and has turned up for their appointment on the wrong day, we can make sure that their GP is aware. Another example is allowing a homeless person to register at our surgery even if they don't have any ID. This allows them to still have access to healthcare.
One of the ways we proactively look after our vulnerable patients is by prioritising our children who are on the child protection plans or who are looked after children. Our admin teams ensure that their notes are appropriately flagged so that when those children or families contact the surgery, we can prioritise their needs.
The most effective tool that we have in safeguarding is communication. Good communication is really vital to safeguard effectively. Communication is particularly important with our patients, their families, their carers and their advocates. It's also really important that we have good communication within the primary care team and with our wider healthcare teams such as school nurses, midwives, learning disability teams, mental health teams and secondary care.
I liaise closely with community pharmacists, hospital pharmacists and the team at the spa surgery to ensure our vulnerable patients have the correct medication and that they receive it when they need it. For example, those with learning difficulties and severe mental health problems. I spend a lot of time with vulnerable patients, the families and the carers, enabling them to understand the medication and how to take it effectively.
The practice endeavours to attend most child protection and adult safeguarding conferences for our patients. We recognise that these are some of our most vulnerable patients, and being involved with these conferences, we can proactively support them with their health needs. It also enables us to work with other agencies for the best outcomes for this group of patients. The whole team are involved in enabling a GP to attend a safeguarding conference, so from the practice manager who supports the GP attendance, the team who manage the rota, the secretarial team who send the reports in prior to the conference, and the coding and summarising staff who ensure the reports from the conferences are accurately recorded and processed.
By thoroughly and systematically summarising new patient records, we're able to identify new patients and families who may be vulnerable and require additional support. We're then able to alert the GPs to these families. For example, through summarising a new patient record, I identified that there was a history of domestic abuse in a household where there was also a young adult with learning difficulties. I was then able to alert Joy, our practice safeguarding lead, to this, who was then able to bring the family in to see her.
Because it's very clear on our patient records when there are safeguarding concerns or that a patient may be vulnerable, I am able to offer the patient additional proactive support and also raise any concerns with their usual GP. In this way we can all work together, and as a team we can safeguard our patients.
Well, I think we're in a really privileged position in the primary care services with access to the most sensitive information about people's lives. So just like everyone in the NHS and the public sector in general, we have a duty to protect the people that we serve. Patients should be safe in the knowledge that when they walk into our surgery, they're welcomed and looked after to the best of our ability, no matter what their personal circumstances. We should not see the duties that we have to safeguard adults as extra work or somebody else's problems. We're responsible professionals and we will do whatever we can to help improve people's lives when they're at their lowest point, and that's what I call doing a good job.